Okay, guys, I want you to take a look at this chart. First things first, you have to have your insulins memorized. You have to know which one is regular, which one's intermediate, which one's rapid or fast. You just have to memorize that. There's no way around it, okay? Once you have that down packed, look at what I have highlighted. Let me tell you something. When you get a test question, and they tell you about particular insulin that you've given to a patient, and they ask you, when would you feed that patient next? What they're really asking you is the onset. Do you know the onset of that insulin? When does that insulin start to work, right? Because you have to make sure that, for example, if insulin starts to work in 15 minutes, you have to make sure that that patient has their food in front of them and that they eat, because their blood sugar is going to start to go down. And we know hypoglycemia kills a patient much faster than hyperglycemia. Look at peak. When you see them asking you, when would be the most dangerous time? When would you assess them, further? When's the most critical time? What they're really asking you about that insulin is, what's the peak? When do we expect the peak of that insulin? Because that's when we expect their blood sugar to be the lowest. Look at what I have for duration. When you see them asking you, when would you expect that patient to get that next dose? What they're really asking you is the duration of that insulin. Do you know how long it lasts for? Do you know when it's going to end for you to give the other dose? Okay, so those are tricks that you can use when it comes to insulin and you're trying to figure out what this question is asking you to know what your answer is, okay?